Hi, I'm Matthew Fisher with Fisher Physical Therapy and One Wellness. What I want to talk to you about now is this idea of lifting. This topic comes up a lot, and you will typically hear people say, lift with your legs. If you're going to lift something heavy, lift with your legs. Well, the first thing I want to say is that's not entirely correct. The most important aspect of lifting is actually what's happening at the level of the pelvis and at the low back. If you look at this model, you will see that there's discs in between these vertebrae, and these discs are filled with a gel-like substance in the middle. On the outside, there's a lot of ligaments. The gel can move around. It's very, very important that when we go to lift something that we're putting the back in a position of a little bit of lordosis. There should be a curve here, and the pelvis should not tilt this way, which would load the discs. It would tilt this way. Discs always bulge to the back, and that's where the nerve roots are. They don't ever bulge really to the front, okay? So we have this issue where people are damaging their back with this idea that you just lift with the legs. Because I can come over here, and let's just say I'm lifting this with the legs, and have my back in a flexed position like this, and I used my legs, but because my low back was in that position, I put a lot of pressure into the discs, and that is where people will tend to create these major problems with disc degeneration and bulging and herniated discs. Okay, so basically you want to be thinking about the position of your pelvis when you go to lift something up. Your low back should be slightly arched. And a very, very key component is that this that we would call the core, the spine and the pelvis, and all the nervous system and the muscles involved there, those should stay stable as the motion should come through the hip joint. If you look at a model, you will see that the biggest ball and socket joint in the body is in the hip joint. It is the hip joint. The most powerful muscle in the body is the gluteus maximus. Those are put together for a reason. They are designed to generate power as the core maintains relative stability. So oftentimes we have to retrain our patients to stabilize through the core and generate the power and the movement through the hips. This is a very, very key concept. You can do it yourself just by taking a stick and placing it behind the back. So there's 3-point contact. This is just like a rod. We got them at Home Depot, and it's like $5. It's like a curtain rod basically for a closet. Okay, you can put that behind your back and maintain 3-point contact between the head, the mid-back, and the sacrum of the pelvis. Okay, and you can work on maintaining the position of your trunk relative to the movement and the power of the hips. Okay, so my hips are moving and generating the power and the movement while my trunk, my core, is remaining stable. And this is training the nervous system to be able to disassociate the spine, the core, from the movement of the hips. Because what most people do when they go to lift something, I'm going to come over here and lift this chair, is what happens is when the lumbar spine, when the hips flex, the lumbar spine flexes as well. It's very important that we train our nervous system to where when we go to bend something up, the core, the spine through the pelvis maintains a proper position, stable, as the movement and power is generated at the hips. This is the way that all professional athletes, especially I see it very clearly in professional football players. If you just watch the way they move, they all move this way. They don't get to that level without either having that quality or gaining it through retraining of the nervous system. It's also very evident if you just watch a sumo wrestler. The best sumo wrestlers, Maybe an amateur might not do that, but the best sumo wrestlers, it's very easy to see with their uniforms, but they generate all that power and movement through the hips as they maintain the stability through the trunk. You could go on YouTube and watch that yourself. So I want to clear up this misconception. Don't say just use your legs, because it's much more than that. It is using your legs, but most importantly, placing your pelvis in an anterior tilt and your lumbar spine in a small amount of lordosis, so it has a curve, and hinging through the hips and being able to stabilize the core, which is a whole nother lecture that requires much more time to explain how we work on that particular factor. Very important thing. There's a lot of bending and lifting that we do in life. Let's do it in a way that builds up the body instead of tearing it down. I hope you got something out of this. Have a great day.